Hi folks, I'm Dr. Matthew Sorkin, the dentist here at Caring Dental Spotswood, and I wanted to speak with you a little bit today about keeping yourself safe, keeping your family and your children safe during this time of the COVID-19 pandemic. Recently, we've been hearing a lot of the news about wearing facial protection, wearing masks when we go out in public, and this may lead you to think that wearing this mask is going to give me the protection I need to keep from getting sick. In reality, the mask is only effective at preventing you from being exposed to the virus if you are close enough to somebody to breathe in the air that they have exhaled, which contains the virus. If we avoid being in a situation where we're exposed to this exhaled air in the first place, we'd have a much better chance of avoiding our risk of becoming sick. How do we do this? Social distancing. What's this mean? Where did they come up with this magic number of 6 feet away from somebody? The evidence shows that the vast majority of the viral particles that are exhaled into the air, whether through coughing, sneezing, or maybe even just breathing, will settle to the ground over a distance of 6 to 13 feet. If we keep out of this zone, we reduce the risk of inhaling these viruses and being exposed to them in the first place. When these viral particles settle from the air, where do they go? They go to the ground, or they go to a surface top. The surface top may be a table, it might be a counter, it might be a door handle. Now when you come along, you touch the contaminated surface, and then if you touch your hand to your face, now you've transferred that virus from the contaminated surface to your face. This is why we often say that you don't catch the virus directly from an infected person, but rather you give it to yourself. This is why we hear so much about hand washing. Frequent and thorough hand washing is the key to avoiding transmission of the virus from a surface to your face. Meticulous hand washing is done by scrubbing your hands vigorously with just plain soap and water for at least 20 seconds. You don't need any surgical scrub or any special disinfecting scrub. Just plain soap and water is effective. 20 seconds is a long time. How do we know if I've been washing my hands for 20 seconds? If you sing 2 choruses of Happy Birthday, we found that this will give you 20 seconds worth of hand washing time. And lastly, we have facial protection. Facial protection acts as a physical barrier, so if somebody sneezes or coughs or even exhales virus that they have been exposed to into the air, the particles will be trapped in the fibers of the mask, and rather than going directly into the air. This reduces the amount of viral load which is on a countertop or in the air that we might be exposed to. Masks don't last indefinitely. A cloth mask should be laundered and rinsed regularly. Regular washing will remove the virus. A paper mask should be discarded if it gets visibly wet or soiled, or if after it's been used for a few times, should be thrown away. And that's it. So I'd like to leave you with 5 take-home points in order of importance, starting with number 1. Number 1, avoid exposure to the virus in the first place by social distancing. Social distancing means keeping at least 6 to 13 feet away from the people that we're with. Number 2, frequent hand washing. We want to wash our hands thoroughly and frequently, so if we touch a contaminated surface, we risk spreading that virus to our face. We want to avoid that. Reduce the viral load on your hands by washing your face. And remember, try to avoid touching your face. People do this unconsciously countless times per day. If you watch your family members, you watch your friends, you watch your kids, see them touching their face, remind them you want to be aware of this and try to minimize touching your face. Lastly, wearing the facial mask is effective at reducing the spread into the air, which reduces the spread onto surfaces that you might touch and then transfer back to your face. Remember that the mask I wear protects you. The mask you wear protects me. Thank you very much. Thanks for your attention.